very renowned gynecologist, a person who has got years and years of experience about the challenges that women face regarding their health, menstrual issues, child care. So here she is to share her experience with us and answer to any queries that you all must be having. So let us welcome ma'am with your NSS clap, please.
Thank you so
Thank
much. I'll start. So good evening everyone. Good evening. And you are most welcome to the city of temples, that is Jammu, and in the state of Jammu and Kashmir. So here I am to talk about personal hygiene and the most common problem which you as an adolescent and teens you are going to face is polycystic ovary syndrome. Am I audible?
Don't make noise.
Hello, hello. Hello? Not audible? Hello? No, I'm audible. Okay. So, I'll be talking about PCOS, the most commonly menstrual problem faced by the adolescents, teens and adults. And I'll be talking about menstrual hygiene, personal hygiene. Okay. So, we start with the personal hygiene. Personal hygiene is very important, particularly in this era because of our lifestyle. We are used to wear tight jeans, jeggings, leggings. Then we are not sitting at home now. Girls are participating in sports, dance. They are busy all the time, and particularly in areas like Jammu, where there is a hot and humid climate, so there is sweating also. And as a result of that, the personal hygiene demands more. Now, the first thing is that you have to change your undergarments every day, and if the need be, you may have to change it twice. Number two, you are very much fussy about the discharge, but I must tell you that normally also there is a healthy discharge, and that healthy discharge is not offensive, not foul smelling, not irritating. Okay, if there is irritation, itching and smell, that means it is infected. But otherwise, normal healthy discharge can be there in the mid-cycle, that is time of ovulation, and premenstrual. But this is not offensive, not irritating. And for that, if this is very much personal. As somebody sweats more, the others may not have sweat. Similarly, one girl may have more discharge and the other may not have. So it's very personal, and if the need be, you can use panty liners. Number two, regarding those menstrual days. The menstrual days duration is 3 to 7 days. Some may have for 3 days, some may have for 7 days. And the average flow needs 2 to 3 pads, maximum of 5 pads per day. If you are passing fleshy clots, that means you are having heavy menstrual bleed and you are losing your own blood. I must clear here only that menstrual blood is our own blood, it is not a dirty blood that you have to shed. No, it is our own blood, and there should be average flow. You should not bleed more. If you bleed more, if you pass fleshy clots, that means you are losing your blood and you will be anemic. And if you are anemic, your performance is going to suffer. You will have lack of concentration, you will have irritability, and your performance, your scoring will definitely suffer. Then you may have normal menstrual cramps, and for that you may need even medication, but that is normal. Out of 100, 30 females may have menstrual cramps, which is known as period pain, and you may need medication for that, no problem. There is no problem in taking medication and be comfortable. You can have vomiting because of pain, you can have giddiness because of pain, but you have to adjust it. But if some female is having more problem, then one ultrasonography is sufficient enough to rule out any medical problem. Then, our body has some protective bacteria also, which God has given us internal strength to fight the infection. Because during period days, naturally the area is wet, but then there are protective bacteria which are known as lactobacilli, which are in the vagina, and they make the pH acidic, and because of that the bacteria, they cannot colonize the reproductive tract, which protect us from the infections. Frequent change of pad during menstrual days, and otherwise nowadays you must be aware of those washes. These washes are not medication. They are just they contain antioxidant these fluids like tea tree oil, which make our skin strong. You just have to apply. You can use it, those washes, twice a week. Just apply them. They are not soaps, they are not shampoos, they are just protective for the skin. You apply them, let it stay there for some 5-10 minutes, then wash it off. But it is not necessary that you use those antioxidant washes every day. The most important thing is that you take care of diet. You should not be anemic to catch infections. You should have good calcium intake in form of milk. 1 glass of milk, 1 katori of curd, and leafy vegetables. You can take egg, meat, chicken, whatever, but any seasonal vegetables like nowadays we have lot of leafy vegetables. Spinach is there, methi is there, palak is there, then we have makki ki roti. All those seasonal food, and according to your area. It is not that you have to go for fancy items, fancy vegetables, positive, no. And by the way, I am happy to share that our dal and chawal, they have been declared as the best diet in the world. We need clapping for that. So we don't need any fancy vegetables, fancy fruits, whatever is available. God has, no comparison to that supreme power. That supreme power has made everything according to our climate and according to our soil. What we need, God has made. If apple is not grown in Jammu, there must be some reason for that. So, no comparison to that superpower. Okay. Now coming on to PCOS, I think. Yeah. So, any question regarding this? Okay, I'll move on to my presentation. Sure. Yeah.
As vagina is has a self-cleaning mechanism.
Yeah.
Are the washes really necessary that are?
No, not really necessary. I told you they are not washes. They are just containing antioxidant which can make your skin healthy. So there is no necessity that you have to use it. You should rather change the sanitary napkins frequently so that you are not wet, right?
So ma'am, in today's market, menstrual cups are in.
I would not recommend menstrual cups for unmarried particularly, and moreover, whenever you are inserting some foreign thing inside, it is automatically going to have infection. Because you cannot always, particularly if you are in a college, hostel, how will you maintain your cleanliness? So it's a big no for unmarried.
Thank you so much, ma'am.
Any other question, beta? Any other question from anywhere?
Show me how. You have that.
Ma'am, I had one question.
I can't see. Yeah.
we have sanitary napkins, and then nowadays we also have cotton pads, like they are made from cotton clothes. Which one is preferable?
Cotton.
Cotton one.
I said only na, there is no substitute to nature. Cotton. We are shifting back to cotton and cloth. Some females may have allergic reaction, whether it's Whisper or some other brand.
Yes. But then there are period panties also. So
Yeah, that is equivalent to using sanitary napkin, but they are more safe as far as your safety point of view, and more comfortable, but very costly.
thank you.
Okay, so this is the patient who is having PCOS. Can you see? There is thinning of the hair, hair on the back, acne, hair on the lips, then hair on abdomen, obesity. Then this particular patient will come to you as infertility, periods problem. Then they are more prone to have even pimples, and you know, waist hip ratio is disturbed, more waist ratio, and dark discolored skin spots. This is the female you would like to look like, right? Okay, everybody wants to look like this. Why? There is no harm in looking smart. Never say no. Here only I will tell you that. Always say yes. There is no harm in looking smart. Am I right?
Yes, ma'am.
Why? It is our right to look smart and beautiful and healthy. Why not? And it is not costing extra. I am giving you my example. I have never been to beauty parlor except my silver jubilee wedding anniversary. I have never been to parlor. I have never got threading. Yes, nothing. And you know, when I was a student, I am remembering this college only. I happened to have 13th class in this college, and my fellow student, you don't go for threading? I said no. You don't go for vaccine? I said no, not possible. She said not possible. Eyebrows तो कराती ही होगी. मैं कहा no. भगवान ने दिया अच्छा दिया. You know, so it is not that for looking smart you need money. No. Okay. So the most common endocrine disorder is PCOS, and it affects 5 to 10% of the female population. Now how this PCOS happens? The most important thing is we are born with PCOS. If somebody has PCOS, that particular, am I audible?
Yes, ma'am.
The particular female is born with PCOS genetic factor. Then environmental factor definitely plays a role, because she may not manifest in the age of 20, 22, or she gets married. Once she gets married, she puts on weight, then she comes to us. But it is not that that particular female say, मैडम पहले तो मैं बिल्कुल ठीक थी, शादी के बाद ही ऐसा हो गया. भाई शादी से कुछ हो, पैथोलॉजी तो नहीं चलेगी ना. शादी से डिजीज नहीं थी क्या? शादी से डिजीज नहीं हुई, because you have put on weight, your lifestyle has changed. So two factors, genetic and environment. These are very important factors to manifest PCOS. In PCOS, what happens? This is normal ovary. This is normal ovary, and this is polycystic. You know why we say it's polycystic? Because there are multiple microcysts. There are multiple. These are not those cysts which need surgery. These are microcysts. The maximum cyst is 10 millimeter, 1 centimeter, 2 to 10 millimeter. They don't need surgery. But what happens, that there should be less of the developing follicles, but in polycystic ovary, it is more than 10 in each ovary. More follicles they start developing, but we don't get a good follicle which ovulates. We get so many small follicles, more than the required number, but we don't get a one dominant follicle. There is ovulatory and menstrual dysfunction, and majority around about 80% of women with PCOS exhibit gross menstrual dysfunction. And the abnormalities of oligo means period occurring after 2 months, 3 months, or sometimes she may not menstruate and she may come to us 3 months, 4 months. And polymeria means the duration shortens. She has 2 cycles in a month. Then there is acne, particularly PCOS females or students, they are more worried about, not about menses, they are worried about acne. But acne is a part of PCOS. Polycystic ovary syndrome. This is also known as nowadays this polycystic ovary disease, PCOD. And you know why we have said PCOD? Because basically this is a metabolic syndrome. Metabolic syndrome means ultimately we are not bothered about periods, we are not bothered about acne, we are not bothered about hair, not infertility. In overall, this particular female is prone to have diabetes, this particular female is prone to have hypertension, and she is prone to have cardiovascular problem. That is why we have shifted from PCOS to PCOD. Now, visible symptoms are weight gain, facial hair, tubular breast, acne, belly fat, thinning hair, dark spots on the skin tags. They have skin tags, small skin tags behind the neck. Their general PCOS symptoms, she is always tired, mood swings, rage, insomnia, and mental loss of sleep, anxiety. They are more prone to depression, craving for sugar, and if after marriage, low sex drive. And internally, as I told you, there are cysts, multiple cysts, microcysts. Then in the body, as I told you, they are more prone to have diabetes. There is insulin resistance. Then pain, irregular periods, sleep apnea because she is obese, and high cholesterol. So these are the laboratory tests which I am not going to tell you, but certain investigation, they help us. The most important thing is that appearance. Then we can have ultrasonography, and then we can have biochemical tests. So what are the various health issues because of this PCOS or PCOD? Irregular menstrual cycle, hirsutism, acne, then long-term health issues and subfertility. Long-term health issues, they are the metabolic consequences of PCOS. There is insulin resistance. As a result, she is more prone to have diabetes. Women with PCOS are at increased risk of type 2 diabetes mellitus, means later onset diabetes, and which is not insulin dependent. In pregnancy, the females who conceive with PCOS, they are more at a risk of having gestational diabetes mellitus, that means diabetes during pregnancy, and there is more chances of having high BP during pregnancy. Then cardiovascular risk, as I discussed, these women have increased cardiovascular risk factors such as obesity. Then there is hyperlipidemia, means high cholesterol levels. No, because of obesity only, they are prone to have obstructive sleep apnea. This is an entity in itself nowadays, that during sleep they have less oxygen. PCOD patient, they are having risk for cancer. That is why I told you, no, we are not worried about only acne and periods problem. We are also worried about her health, because this is a patient who is going to have increased risk of endometrial cancer, uterine cancer. Management. The most and the foremost thing is lifestyle management. Then we have medical management, means drugs, and then if not connected with all this, surgical management. You have always been beautiful. Now you are just deciding to be healthier, fitter, faster and stronger. Remember that. Loss of weight results in spontaneous resumption of ovulation, improvement in fertility and normal glucose levels. And a loss of weight, how? She has to have exercise for minimum of half an hour and which is sweat inducing. Then only she can have her menstrual problem corrected without drugs. Minimum she has to lose 5 kg of weight so that she can have improvement in the symptoms like acne or menstrual problems. 30 minutes of sweat inducing exercise. Eating well is a form of self-respect. Now, medical we have drugs like the, we are lucky to have a simple drug and very cheap metformin, which increases the insulin sensitivity. As I told you that basic pathology is that there is insulin resistance in our body and the simple drug metformin, this increases sensitivity of the insulin. We can take the help of weight reducing drugs also. There are drugs which will cause satiety and you may have to skip your meal because you don't feel like eating. But at the same time then you have to be careful about your vitamin supplementation and all. Fitness is like a marriage. You cannot cheat and expect it to work. Then surgically, obesity can be corrected, bariatric surgery, but not a favorable choice because they have their own health hazards. A little progress each day adds up to big results. Now, before marriage, the concern is menstrual regularity, and after marriage, the concern is childbearing. Okay? And the basic basic funda that you must bleed 6 times a year. Even if you have PCOS, it is not necessary that you have to bleed after 30 days. Even if we bleed the female for 6 times a year, that is okay. That is okay for her health. But after marriage, the concern is pregnancy. And it is very simple mathematics that if a female is menstruating for 12 months a year, right, 28 day cycle, so she will have 12 bleeds per year. That means she is having 12 chances of having conception in a year, right? And if she is bleeding after 2 months, then it is half. One thing is that if she is menstruating after 2 months, she may not ovulate because it is not a normal cycle, right? Even if she ovulates, the chances are halved, right? Now, management of infertility, weight loss, then we have very good drugs to induce ovulation induction because what happens in PCOS that there is no ovulation, if there is no ovum release, there is no hormone which is responsible for menstruation. Menstruation happens once there is no pregnancy, right? But ovulation has to be there. Okay? Because what is menstruation? Menstruation is that uterus lining breaks because there is no pregnancy. If there is pregnancy, uterus lining, then it grows. So, there is no need to worry like her. With medical management, around about 60 to 85% women they ovulate. But not, this is ovulation. She will have regular periods, But it is not that 60 to 80 will have pregnancy. Only 40% conceive. But periods are regular. Most pregnancies occur within first 6 ovulatory cycles after treatment. So metformin is a wonder drug for PCOS, very simple and no side effects. Then if not correctly medically, there is surgical treatment also, which is the last one. So this is the result. Then IVF we have. Management of hirsutism. Before marriage and as a girl, I think it's not working. This is working. Okay. So before marriage, we are worried about the hirsutism, means hair growth, like upper lip, chin, breast, abdomen. So for that, we have drugs which are anti-male hormone. We can use that. But the hair which are already there, they cannot be replaced with drugs. So for that, you have to go for laser, electrolysis, whatever treatment is available in the market, right? So this is the typical PCOS. This female has PCOS. Okay? And see how much hair growth she has. She is a female, she has PCOS, she has beard. A model with 6-inch long facial hair has become the youngest woman in the world to have a full beard, according to the Guinness World Record. Body positivity campaigner Harnaam Kaur, 24 years old, from Berkshire, said it was humbling to be included in a modeling, and she described her beard as a part of her quest to overcome years of bullying to cope with her appearance. And you are, I think it is still in your memories that 3 months back, a girl from Bihar who topped in board examination and she was bullied. No fault of us. So these are the black spots. This is acne. If hirsutism is mild and it is not significantly impacting her lifestyle, or mental health, or her self-esteem, no treatment is required. You have to be strong enough to face it. Okay? In women who are overweight, weight loss decreases serum insulin levels and male hormone production also decreases. You know, each and every female has male hormone. We have male hormone in our body, but in PCOS, this male hormone is more. Shaving, waxing, plucking, bleaching, electrolysis, lasers, they all help. This is a typical picture on ultrasonography, and this is known as necklace ring appearance of the ovaries. Small follicles, peripherally arranged, these are microcysts. Then we have simple drugs like OC pills, which can take care of the high male hormone and decrease the further growth of the hair. September is a PCOS awareness month. What was the need to create a month for the aware? Because our students were suffering. They were hiding. They were not able to, their self-esteem was suffering. And I am happy to share that even Sara Ali Khan has told publicly that she had PCOD, she was obese, she lost weight, and now she's okay. Sonam Kapoor, she was obese, she had PCOD, she lost weight, she's okay. Now, I told about drugs, but accessories you can go for this, adjuvants, which will improve the total metabolic function in the body of PCOS patients. These are, nowadays, these are inositol, which are, inositols are again antioxidants, D-cycloinositol, N-acetylcysteine, vitamin D. It has a proven role that your vitamin D levels, which is a very simple thing to have, to consume. You should have 8 shots of vitamin D per year, and there is a strong correlation between the manifestation of PCOD and the vitamin D. Then folic acid will help, omega-3 fatty acids, OCP I told you. And if some female they are very obese and her lipid profile is abnormal, we can take the help of statins. Will it work? मीडिया प्लेयर है इसमें? है? अगर है तो करेंगे नहीं तो. This is about Zumba dance which we have to do to reduce weight. So this was about PCOD. You should not worry about this. This is very much correctable. Drugs are available, very much treatable. नहीं इसमें मीडिया प्लेयर होगा तब चलेगा. So in the meantime, I can take your questions. Yeah.
Ma'am, are type 1 diabetic females more prone to PCOS?
Type 1.
Type 1.
Yes. See, type 1 diabetes is a different thing at all. And there is no relation with PCOD. Okay? Because type 1 is insulin dependent. She is type 1 diabetic right from birth. Okay? But PCOD patient, they can have diabetes later on, which is type 2.
Ma'am, I want to ask you, oftentimes we see every next female has facial hairs,
Yeah.
lips and everything.
Yeah.
You said it's a part of PCOD, PCOS, but even if you go and check it out, so many a times they don't show it to you, or it doesn't comes out on your report.
Yeah, you are very right.
So,
See, this is one manifestation of PCOS. But we have another terminology also nowadays that is known as androgen excess, where there is no morphology of ovaries as microcysts, necklace. On ultrasonography, you don't get PCOS morphology, but this is falling under androgen excess syndrome, right? We have a society now, androgen excess society.
and I guess same goes for the acne also, because
Yeah, male hormone is responsible for hair and acne also. Okay.
even though like I started having acne on a very different period of my time. Like I'm in my 20s, and it's not a puberty age. I don't know why it started. I got checked.
But you have to have, if you have acne, you have to be put on that anti-male hormone. Na? We have simple OC pills. You can take that. Everything will be corrected. Hair, acne, right? Because you may not be PCOD, still you can have acne and hair. That is because of androgen excess. Male hormone is more in your body. Okay? And then it is not that always you think that if you have hair and it is only, no. We have to rule out other reasons for male hormone. Like there can be a tumor from adrenals, which is producing more male hormone. So not that every hirsutism, every acne is PCOD. No.
And also there is a misconception that if you eat a lot of junk food, you are prone to have this more of this facial
But
hair.
these two definitely have relation. You know why? Obesity leading on to insulin resistance. Insulin resistance leading on to more formation of male hormone.
But what if you have a fast metabolism?
Sorry?
What if you have a fast metabolism?
If your weight is okay, then there is no problem in taking anything. But overweight, insulin resistance. Insulin resistance, more male hormone. Yeah.
In case the cysts are really small, so should we go for lifestyle changes or should we directly go for a surgery?
If the
Cysts are really small and
there is no role of cyst for this microcyst. I told surgery only, you know why? Because we are not going to remove cyst in surgery. What we do is that is known as ovarian drilling. Not we remove the cyst. By doing ovarian drilling, we decrease that male hormone levels. Okay? We don't remove the cyst because these are microcysts. These are not those cysts which need surgical removal. Windows मीडिया प्लेयर है वो मेरा वाला चला रहा है एंड वन स्लाइड इसमें ये PCOS ये and with here and with here. Thank you sir. ये this one. चलेंगे जो है ना कोई बात no problem. Any other question? Any other question maybe not related to PCOS, maybe not related to personal hygiene. Any question I can take?
Ma'am, how much of irregular periods should make us worry that we should go to the doctor or take some steps?
Regularity of period, na? Okay, I'll tell you. First thing is that what is the time for menstruation to start? Nowadays it is come down to 10 to 12 years. Okay? If it is less than 10 years, still we don't do much. If it is less than 8 years, needs investigation and treatment also. Okay? Because the 8-year child cannot handle the periods. Now, previously it used to be 14 years. Okay. Now, you started with your periods. It may take 1 to 2 years for the periods to be regular. Don't bother that if you don't bleed for 2 months after you starting your periods, it is PCOD. No, we don't label the patient as PCOD for 2 years following periods, because that hypothalamo-pituitary ovarian axis takes time to settle down. Not every female 12 years old who started with periods just 2 months back is not having periods, doesn't mean that she is having PCOD. Don't label every patient as PCOD. It takes 1 to 2 years for the periods to settle down. But that doesn't mean that your sister or your child who started with periods, no, she doesn't have periods for 3 months, you sit at home. No. Because even if she has periods after 3 months, she will bleed heavily. You need to have consultation. We do simple ultrasound, see the lining, but there is no worry that she is having PCOD. Next, your duration. Na? You want to ask about duration? 3 to 7 days. Some may have for 3 days, some may have for 5 days, maximum 7 days. Then occurring after 21 to 35 days. Some females bleed after 21 days, some may have up to 30. Our average is 21 to 35 days. 3 to 7 days. Okay, your question is answered?
Yes, ma'am.
No problem, nahi chalta random. Okay, ma'am?
Any query? Is that all? Any other query?
Yeah? I'm not able to hear you.
Come forward and use the mic.
Come here, come here.
आगे आ जाओ इधर आके इधर कर दो बच्चे
आप पूछो, यहीं से पूछो।
अगर मैम किसी फीमेल लेडी को PCOS है एंड शी कंसीव, तो क्या चांसेस है कि उसके फीटस को भी, मतलब क्योंकि आपने बोला कि
जेनेटिक है, हाँ,
तो क्या उसको भी हो सकता है?
नहीं ऐसा तो नहीं होता, कोई भी जेनेटिक डिजीज बेटा जरूरी नहीं 100% जाए, बट वी आर प्रोन टू, राइट? और एट द सेम टाइम वुड लाइक टू क्लियर, all PCOS patient don't need treatment for conception. I have a patient who is a patient of PCOD, and every time she would come to me, she comes with pregnancy, but otherwise no periods. She doesn't bleed, and she had 2 children, but she comes with pregnancy only. Otherwise she doesn't bleed. She was not bothered. So it is not must that if you have PCOS you will not know. Right? Some cycle may be ovulating. Right? Okay?
पूछो बेटा
So ma'am, my question is, how many cycles in a year are normal? Like, is it compulsory to have 12 cycles?
No, I said some may have a cycle after 21 days. Then she will have 14, 15 cycles. In a year, yes, I am saying now. I am saying that some females may have a cycle after 21 days. Some have 25 days, some have 28 days, and some up to 35 days we give it as a normal, right?
So if we like miss 1 or 2 months, it's fine.
Yeah, in a year, if you see, if you are having a cycle after 28 days, right? And you don't have for 35 days, it is abnormal. Because your duration is 28 days. You should almost have 28 days, right?
Ma'am,
Yeah.
is it normal to have 2 periods in a month? Like
No, it is not normal to have 2 periods in a month. But you know what happens? Our concept is that जनवरी में एक ही बार पीरियड आएगा, लेकिन अगर 25 दिन के बाद आना तो 2 बार ही आएगा ना, ठीक है? Because this is your individual. Average is almost 80% females have after 28 days. But some have after 25 days, some have after 32 days. So you should know your cycle. You should not compare with others. You have to be particular about your duration. But if your cycle is of 25 days and no, you don't bleed for 30 days, it is abnormal.
Ma'am, another question I have is having excess pain during your periods is also normal?
No, 30% females do have pain, but that is just relieved with medication or in hot water bottle. But if you have excess pain, one ultrasonography you must go for it. Because
What if nothing comes out in the...
no problem. And with pain you can have vomiting, with pain you have giddiness. You know why? Because there is liberation of prostaglandins. And prostaglandins they cause cramps.
But then also you get like this dizziness and nauseous.
Nauseous because of prostaglandins.
And most of the times I feel like I'm getting stressed because of the periods. Not up before them or after that. During the periods time it becomes...
Some females have before mood swings.
Yeah.
Even that is... that some females do have that. But all the things can be explained because during menstruation, why we bleed is because of prostaglandins, and these prostaglandins are responsible for किसी को डायरिया रहता है, किसी को वॉमिटिंग हो जाती है, पेन उसी की वजह से, क्रैम्प्स उसी की वजह से, ये फेंटिंग अटैक्स आ सकते हैं, ठीक है? But you should be able to handle it. You should know what makes you comfortable, right?
Also there is a misconception that you cannot take more of
Nothing, no diet, nothing.
But that menstrual spas,
Okay.
is that
class.
okay?
Yeah, because it's a good company, but you should not take empty stomach, right?
Yeah.
Okay, that's it.
Any other question?
Good evening.
मैम मेरी एक फ्रेंड है वो 24 इयर्स हो गए हैं
Okay.
एंड मैम उसे पीसीओडी है उसे 3 साल पहले पता चला था
ठीक है.
एंड मैम वो उसे डॉक्टर से हेल्प ली एंड उसे मेडिसिन और सीड्स दोनों लेने के लिए बोला डॉक्टर ने
Medicine or what?
सीड्स
Seeds. Okay, antioxidant. Okay.
तो मैम वो कभी भी अगर मेडिसिन स्किप कर देती है तो उसे पीरियड्स नहीं होते हैं और मैम अगर सीड्स भी कर देती है तो नहीं होते तो मैम मेडिसिन के कोई साइड इफेक्ट भी हैं क्या
You have asked a good question, and I would like to clarify one thing. Beta, if you have PCOD, you must start medication, simple medication, oral contraceptive 6 months before you get married, so that you are having after marriage, because OC pills what they do is they decrease the male hormone in your body, and after marriage you will have normal cycles also and more chances of conception also. And what you are saying is that once she doesn't take, after taking 3 cycles of pills, you have normal period for 2 months because your hormonal imbalance is corrected. So after 3 months cycle with treatment, 2 months will be regular. Okay, but otherwise PCOS is not, it cannot be removed from your body because it is in our genes. It is treatable. You cannot eradicate it, right? But if you check your weight, then you may not be symptomatic. Generally, लोगों को 35 ईयर से पता चलेगा, बच्चे पैदा हो जाएंगे कि उसको PCOD, because पहले उसका weight कम था. Now she has put on weight, she has become symptomatic. Okay, your question is answered.
और मैम उससे मतलब थोड़ा सा भी स्ट्रेस लेके आना तो उसको 2-3 महीने के
मैंने बताया ना, they are more prone to anxiety, depression. But there is no harm in taking pills. Only thing you have to see is that your liver is functioning properly. Before starting OC pills, we get a liver function test. If liver function is okay, she can simply very well take OC pill. And all those students, females who have PCOS must start OC pills which contain anti-male hormone before you get married. Leave it after marriage, conceive and forget.
Any other query, beta? That's it. We call it a day then. Thank you so much, ma'am, for your presence and sharing all the queries. Thank you so much for your time.
It's my pleasure.
Honoring ma'am, she has lived a very good and very important part of your life, explained very well. So I hope give a huge round of applause with NSS class.
Thank you so much. मैंने उससे भी फोटो ले लिया।
बेटा मैम का कैमरा से लेना।
ये भी रखें।
मैं ऐसे डिलीट कर रही फोटो जैसे मेरे को